The CDC has issued its recommendation for the updated COVID booster. The panel voted to recommend the shot universally for anyone over the age of 6 months. Health experts say priority groups include people over the age of 65, those who are immunocompromised, people who are pregnant, and young children. Joining us now is Dr. William Schaffner. He's a professor of infectious diseases for Vanderbilt University Medical Center. Dr. Schaffner, it's always good to see you. What do you hope these boosters will accomplish?
Well, I certainly hope that they will be accepted by a large proportion of the population in order to mitigate the impact of COVID going forward this winter. We expect further increases in spread that will result in more hospitalizations and, I'm afraid, more deaths. And we'd like to limit that. These vaccines will be able to prevent the development of serious disease, prevent hospitalizations, and of course, that's our goal. So we hope that it'll be widely accepted, and we can dampen the impact of COVID going forward.
So what do you tell those who say that they've had enough shots, that they feel they're not part of that sector of the population who might be at higher risk and don't want to get a booster?
Well, I would try to persuade them otherwise. You know, this is a virus that can take a perfectly healthy person and put them in the emergency room short of breath within 48 hours. So it continues to be a very serious infection. And although it is true that older people with chronic underlying illnesses who are immune compromised are at greater risk, it is striking that we still see people, and indeed children, who are perfectly healthy and vigorous still require hospitalization due to this virus. So we can't write it off. We've got to respect the virus, and the best way we can protect ourselves, our families, and our communities is, of course, to be vaccinated.
A CBS News poll that was just recently done shows that fewer Americans are concerned over new variants. Some 52% was the latest number, and that does not. 52% are not concerned. 58% were concerned when we were dealing with the Omicron variant. What do you make of that?
Well, it's clear that the Omicron subvariants, although they're very contagious, aren't quite as serious. But I said not quite as serious. They're still causing a lot of serious disease. And the other thing that people perhaps don't appreciate is that even though they've had COVID in the past or have been vaccinated or even had both, your protection is going to wane over time. And all of our immune systems have to be reminded periodically to stay on the alert to protect us. And so we're moving, just as we do with influenza vaccine, to an annual updated vaccine. So let's get our COVID vaccine, let's get our flu shots this winter, and we can abate what it is that both of these viruses are going to do.
And are we talking twice a year, or is once a year enough?
Well, you know, ideally, we would like to give it more often, but what's practical and what we hope will be accepted and feasible is an annual updated booster. That's what we do with flu. That's what we're planning to do with COVID. And so far, so good.
Thank you so much, Dr. William Schaffner.
My pleasure.